Did you know there's a whole other side of postpartum depression that many don't know about? We call it perinatal.
Welcome to our channel where we give tips for surviving motherhood and provide a place for honest conversations about women's mental health. We make new videos every Monday, every week. We hope you like our video and don't forget to subscribe below. In our last video, we mentioned that there's a whole other side of postpartum depression that often gets overlooked. Felicia, can you tell us a little bit about perinatal anxiety?
Yeah, so perinatal anxiety can occur during the perinatal period, which is that time during conception, during pregnancy, and during the postpartum period. And it includes symptoms such as constant worry, fear of leaving your baby alone, even with people whom you would normally trust and feel that was safe, feeling that something bad is going to happen, experiencing racing thoughts, difficulty sleeping even when the baby is sleeping, disturbances of appetite, the inability to sit still, or suddenly finding that you're more productive than your usual self. Physical symptoms such as dizziness, hot flashes, nausea, panic attacks, and intrusive thoughts. And perinatal OCD, which looks a little different than how people typically picture OCD. We'll talk about it more in a later video. And then we have some risk factors for perinatal anxiety that are the same as those with postpartum depression. These risk factors include a history of mood disorders or a family history, a history of infertility, thyroid issues, diabetes, perinatal mood disorder, and having multiple children under the age of 5, just to name a few.
Yeah, so perinatal anxiety is actually more common than perinatal depression, yet it is often overlooked because people don't even know about the anxiety component. And so they only really think about the feelings of sadness and crying and postpartum depression as being something that needs help. So they don't recognize that the anxiety and the things they're feeling is actually a sign of perinatal anxiety. And we'll talk more in another video about why perinatal mood and anxiety disorders gets overlooked. So Felicia, can you tell us more about the idea of an intrusive thought? Like, what does that mean?
Yeah, I want to be careful to not give too much detail as to not trigger somebody else and make them feel more anxiety. But here's kind of a generic example of an intrusive thought that many of us have probably experienced at one point. If you are driving down the highway and the car in front of you suddenly slams on your brakes, and you have this picture in your mind or this thought of your car slamming into them, we call that an intrusive thought. And for moms, during pregnancy and postpartum, their intrusive thoughts are typically surrounded more about harm coming to their baby. If you've experienced an intrusive thought, give us a thumbs up in the comments below so that you know that you're not alone. Please be careful to not go into too much detail about your intrusive thoughts as to not increase anxiety for more moms.
Well, that's all for today. Today we discussed perinatal anxiety and how it is even more prevalent than postpartum depression, but is often overlooked. If you or someone you love are struggling with a perinatal mood and anxiety disorder, please reach out to the Postpartum Support International warmline at the number below for support and locate resources to a trained professional in your area. Thanks for watching. Don't forget to subscribe to our channel for more videos about surviving motherhood. Bye.